In Good Health, brought to you by McLaren Northern Michigan.
Did you know that BPH, or benign prostate hyperplasia, is estimated to affect 70% of US men aged 60 to 69 and 80% of those men aged greater than 70 years old? It doesn't mean that it doesn't affect younger men. In fact, over 50% of men have symptoms over the age of 50. I'm Matt Roloff, and I'm a urologic surgeon here at McLaren Northern Michigan. BPH, or benign prostate hyperplasia, essentially is just continued growth of prostate cells that essentially lead to obstruction of urinary flow. All men are at risk. It's a disease of aging, unfortunately. The common signs and symptoms of BPH are decreased urinary flow, hesitancy, getting up at night to go to the bathroom, and the urge to go to the bathroom and the inability to make it to the bathroom in time. There is no magic test that diagnoses BPH. It's essentially just based on talking to the patient and seeing what their symptoms are. We have all of our patients fill out a questionnaire when they come to see what component of the BPH is most bothersome to them, whether it's getting up at night, the urgency, the weak stream. So there are different components that are more bothersome to different patients. The treatments for BPH are wide. Typically what we'll do is we'll start you on a medication to help relax the prostate, or another medication might help shrink the prostate. Depending on the severity of your symptoms and the size of your prostate, we have a whole host of options that we can provide men suffering from BPH. Those include something called the Urolift, which tacks up the prostate. We can resect out some of the prostate tissue to open up the urinary channel. And so there are a lot of different options when it comes to treatment of BPH. If BPH goes untreated, what can happen is the bladder is attempting to contract against an obstructed outlet. And the bladder, just like any muscle, gets tired. And if the bladder gets tired enough, then it might not contract anymore. So that's why it's important to get your BPH evaluated and see if there's a surgical option that we can provide for you. So if medications aren't working for you and you're still not happy with your BPH symptoms, make an appointment with us. We'll be able to evaluate you, see what your main complaints are, and possibly even be able to offer a more minimally invasive approach to get you off of those medications you have to take on a daily basis.
For more information or to schedule an appointment, go to mclaren.org/northern or call 800-248-6777.